So we are going to talk about distraction osteogenesis, also known as callotaxis. This is usually applicable in open fractures. Open fractures are the one in which the fracture is communicating with the environment. In case of open fracture, if sometimes some piece of bone may be lost during the RTA or any other causes, if one or two of the fragments or segments is lost, then distraction osteogenesis can be done, in which new bone is formed in place of the lost bone. In case of and this is done by first cutting the bone, that is also known as the corticotomy, and then placing the frame. The frame is of Ilijarov ring fixator. Usually it is of Ilijarov ring fixator, which is circular. I will draw it in figure. Once this is done, then distraction is applied at the corticotomy site at the rate of 1 mm per day. It is only done 1 mm per day because the bone, the physiological limit of the bone to grow per day is only 1 mm. As a result of which a new bone is formed in place of that lost bone. This is known as distraction osteogenesis. I will show this in diagram that may help. Suppose this is our fracture, and suppose this part is lost. This part of the bone is lost. Then first corticotomy is done. Corticotomy means removal of this part, and then these both part will be approximated. And frame of Ilijarov ring fixator is now inserted. These are initially approximated towards each other. Then every day 1 mm distraction of 1 mm is done every day. So the next day it will be like this. Another next day it will be like this. Since bone can reproduce, so a time will come when new bone will be formed in place of this lost bone. This is known as distraction osteogenesis, callotaxis. I have written a note of it like this: Ilijarov ring fixator in distraction osteogenesis or callotaxis. In case of open fracture, if a fragment of bone is missing, it can be replaced by growing a new bone. This is known as distraction osteogenesis. Now this was the figure that I have drawn. This is done by first cutting of the bone. This is known as corticotomy, and then placing the frame. Once this is done, distraction is applied at the corticotomy site at the rate of 1 mm per day, because it is the physiological limit of the bone to grow per day. As a result of which a new bone formation will take place. This is known as the distraction osteogenesis. Hope this has helped.